Hi, I'm Dr. Warren Mansell, and I'd like to take a minute to tell you about a new talking therapy for people with bipolar disorder. The therapy is called TEAMS, and this stands for Think Effectively About Mood Swings. TEAMS is a form of cognitive behaviour therapy, or CBT, and it's based on what we have learnt from a series of research studies and from talking to service users. TEAMS is different from what else is available because it integrates the most helpful elements of successful therapies into a single approach. In particular, it aims to help people achieve their personal goals and focus on what is important to them. In TEAMS, the therapist and the client work together to think about moods differently and to manage moods in ways that are most effective in the long term. TEAMS has been provided to a series of people with bipolar disorder over the last 5 years, and the results have been very promising. In particular, TEAMS appears most suitable for people who experience mood swings which they find distressing. Examples of distressing experience include anxieties, depression, irritability and agitation. The current therapy trial aims to refine the therapy and also to check the feasibility of delivering it to people who live across Greater Manchester. We're recruiting people from all kinds of sources to participate in the study, including community mental health teams, GP surgeries, service user groups and a range of community services. It's not essential that someone interested in this study already has a diagnosis of bipolar disorder, as we will be assessing this. What is particularly important is that the person must be willing and able to attend an outpatient setting for around 16 sessions of therapy. Anyone from 16 to 65 who you think may have bipolar disorder can be referred. People can also self-refer if they wish to take part, so we're really keen to hear directly from service users as well. The study itself starts with a brief interview to see if the person meets our criteria. If so, the person then has a 50% chance of receiving TEAMS and a 50% chance of continuing to receive their usual treatment. Even if the person is receiving TEAMS, they will still continue to receive their usual treatment, including medication. The patient's healthcare coordinator will be notified if they do receive TEAMS. We'll be asking people about their previous experience of treatment and what they would like from therapy. The assessments are then repeated after 3, 6, 12 and 18 months. They will be in an outpatient NHS setting, such as a participant's CMHT or GP practice, and the participants will receive expenses paid for each of their visits. We want to try and make it as easy as possible for you for people to take part. So if you have a client who's experiencing distressing mood swings, then please mention this trial to them and see if they're interested. You can then liaise with the TEAMS researchers using the contact details on this slide so that they can make contact and see whether the person can take part. The contact details are the same for self-referrals as well. So thank you for your time, and I hope we've piqued your interest in TEAMS therapy and the research.